This is Dr. Michael Coe from Movement IQ Physical Therapy. I'm going to show you how to use a foam roller for your hamstrings and your quads. I'm going to start with the hamstrings. Simple way of doing this foam roller is to put pressure onto the hamstrings at the back of the thigh, and you can roll forward and backwards. I'm going to do the entire length of the hamstring and keep this leg straight, but hamstring is a large muscle, so I want to hit it in different angles. So one other thing I can do is roll my foot outwards, try to get more of the outside hamstring. I could also turn my foot inwards and get the inner hamstring. Another thing I can do is if I don't feel like that pressure is enough for my leg, I can add more pressure by adding the other leg on top, putting more pressure and weight down on those muscles, and then go ahead and roll. And then I can add the twisting in or out. Right? Another thing I could do is, because it's such a large muscle, there might be certain parts of that hamstring that are way more tight than others, where there's more restrictions or adhesions. Those adhesions tend to be tender, so if you feel a little pain or some tenderness, I'd rather you spend some time on there. So if I find a spot that's painful, let's say, for instance, it's painful here, what I can do is I could just spend my time over that tender spot instead of going through the entire leg. Right? And then once I put some tension on that spot, I can roll back and forth. Another thing I can do is find that tension spot and stay there, and then I can move a body part instead. In this instance, what I'm going to do is I'm going to bend and straighten out my knee back and forth. I can even add toes up, get a little more fascial tissue towards the back of my leg to stretch, and I can add a knee bending and straightening to get some more tension through those muscles. Now, if I'm going to do the quad, I'm going to lay on top of this foam roll. I'm going to go forward and backwards. And I'm going to roll back and forth. Same rules apply here. I can go through the entire quadriceps, a large muscle. If I want to hit different angles, I can turn my foot inwards, get the outside part of the quad, or I can turn my foot outwards, get the inside part of the quad. Another thing I can do is find that tension spot. Right, let's say it's here, and I can then move my knee back and forth. Or I could move my leg back and forth this way. That's another thing we can do. That's movement, internal external rotation of the hip. Or I could then pre-stretch those muscles, and I can roll forward and backwards. Try out all those options, see which one works best for you.